Good morning, everyone. Welcome back. Thank you for joining us. I'm Steve.
And I am Scott.
And together we are Backyard Musings, the Science and Technology channel.
Yep, and we're talking about another health issue today. Talking about something that probably 90% of the world out there takes at one time or another, I'll bet.
And it could have secondary beneficial effects.
Could, yeah.
Ibuprofen's anti-inflammatory action may influence cancer risk, but evidence remains complex and routine use for prevention is not advised. Ibuprofen is one of the most widely used pain relievers, commonly taken for headaches, menstrual pain, and other everyday aches. New research suggests that its effects may extend beyond pain relief and could include potential anti-cancer benefits. Would you like to know more?
You know, I like the fact that they throw that out there, but you know how many people are going to say, oh man, I got cancer. Maybe I'll forego going to the doctor and I'll just start popping 4 or 5.
Scott said, so let's do it.
Yeah, that's just kind of scary. As scientists continue to explore how chronic inflammation contributes to cancer, ibuprofen has drawn growing attention. This has prompted fresh discussion about whether a familiar over-the-counter drug might also play a role in reducing cancer risk.
Ibuprofen is part of a group of medications known as non-steroidal anti-inflammatory drugs, NSAIDs. Interest in NSAIDs in cancer prevention dates back decades. In 1983, that was a good year, 83. Clinical evidence showed that Sulindac, an older prescription NSAID, similar to ibuprofen, was associated with lower rates of colon cancer in certain patients. Since then, researchers have examined whether other drugs in this class might help prevent or slow the development of different cancers.
NSAIDs reduce inflammation by interfering with enzymes known as cyclooxygenases.
Yep.
Okay. Or COX for short, COX. Scientists generally prescribe 2 major forms. COX-1, which helps with everyday maintenance tasks like protecting the stomach lining, supporting kidney function, and enabling normal blood clotting. And COX-2, which plays a larger role in producing inflammation.
Because many NSAIDs, including ibuprofen, block both COX-1 and COX-2, doctors often advise taking them with food instead of an empty stomach. I've read that on prescription bottles a lot.
I always do that. I don't take ibuprofen, but any kind of medication like this, I always take. Drink it with milk or food, yeah.
Right. And as of now, you don't take it, but you might be taking ibuprofen, right?
Ibuprofen is not something that I normally take. I'm usually more of a hardliner.
Oh, you just
aspirin.
Grin and bear it?
Aspirin, yeah. Oh. Well, no, I take aspirin. I mean, that's my go-to for headaches or pains or whatever.
Oh. A 2025 study suggested that ibuprofen could be linked to a lower risk of endometrial cancer. This is the most common type of womb cancer. Womb, W-O-M-B. I don't know if I'm pronouncing it right. Womb cancer.
I would say that.
Yeah, and it begins in the lining of the uterus, the endometrium, with most cases occurring after menopause. Yeah,
so most of this stuff, right, really can attack like the kidneys and like Tylenol. They always say too much Tylenol could affect your kidneys. Ibuprofen could affect your stomach, and then again we get obviously issues like this one. We get cancer issues in the stomach and in the plumbing parts too. So, okay, where am I at here? Excess weight?
Yep.
Yeah, excess weight is considered one of the most preventable risk factors, partly because higher levels of body fat can raise estrogen, a hormone that may encourage cancer cell growth.
And this is different from estrogen. Estrogen is different from estrogen.
Yeah, it comes from the ostrich.
Right.
Right. Yeah.
It's spelled OESTROGEN.
Right.
Additional risk factors include increasing age, hormone replacement therapy, particularly estrogen only, HRT, diabetes, and polycystic ovary syndrome. Risk is also higher for people who start menstruating early, reach menopause later, or never have children. Possible symptoms include abnormal vaginal bleeding, pelvic pain, and pain during coitus.
Ooh, okay. One major analysis came from the prostate, lung, colorectal, and ovarian study, which followed data from more than 42,000 women aged 55 to 74. That's quite a range and a lot of women. They did that study for 12 years. Participants who said that they took at least 30 ibuprofen tablets each month.
Wow, that's daily.
Yeah. Had a 25% lower chance of developing endometrial cancer compared with those who took fewer than 4 tablets per month. That's toughing it. The association was most pronounced among women with heart disease.
So I wonder if you take 4 per day, if that'll give you 100% lower chance.
I don't know, but I know the last couple of times that I've had some major dental work, they have prescribed 800 milligram ibuprofen.
The horse pill.
Yeah,
yes.
the big red one, I think it is.
Yes, we love that.
Yeah, those, when I take those, and again, I don't know if you can compensate by taking the weak sauce ones that you get across the counter that are usually, I think, around 200 milligram. I don't know if you can take 4 of those at one time and have it balance out. I don't know.
Probably not.
Probably not. Yeah, because when I've taken the 200 milligrammers, like I said, they don't really do much for me. At least I don't feel they do. But when I've taken the 800 milligrammers, I'm good. Yeah, they've been good. So.
Okay. Aspirin, which Scott swears by, another widely used NSAID, did not show the same relationship with lower endometrial cancer risk in this or other studies. However, aspirin may still play a role in reducing the chance of bowel cancer coming back.
Yeah, it'll mess with your stomach, I guess. Yeah, and another thing that's about aspirin is that it's kind of a blood thinner. It'll thin your blood out a little bit. So not that I have thick blood, but anyway. Researchers have also examined other NSAIDs, including naproxen for possible effects on colon, bladder, and breast cancers. Overall, results suggest the impact of these medications may vary depending on the cancer type, a person's genetics, and their underlying health conditions.
Yeah, I've taken naproxen before. Ibuprofen's possible cancer protective effects extend beyond endometrial cancer. Studies suggest it may also reduce risk of bowel, breast, lung, and prostate cancers. For example, people who previously had bowel cancer and took ibuprofen were less likely to experience recurrence. It has also been shown to inhibit colon cancer growth and survival, and some evidence even suggests protective effect against lung cancer in smokers. Smoke it up and take the ibuprofen.
Yeah, a little compensation deal. I don't take ibuprofen, but if I had any of these issues and they said, hey, you should probably try this, I'd be all over it. Yeah. Inflammation is a hallmark of cancer, and ibuprofen is, at its core, anti-inflammatory. By blocking COX-2 enzyme activity, the drug reduces production of prostaglandins, chemical messengers that drive inflammation and cell growth, including cancer cell growth. Lower prostaglandin levels may slow or stop tumor development. That's a good thing too.
But that's only part of the story. Ibuprofen also appears to influence cancer-related genes such as HIF1 alpha, NFKB, and STAT3, which help tumor cells survive in low oxygen conditions and resist treatment. Ibuprofen seems to reduce the activity of these genes, making cancer cells more vulnerable. It can also alter how DNA is packaged within cells, potentially making cancer cells more sensitive to chemotherapy.
But not all research points in the same direction. A study involving a little over 7,700 patients found that taking aspirin after an endometrial cancer diagnosis was linked to higher mortality, particularly among those who had used aspirin before diagnosis. Other NSAIDs also appear to increase cancer-related death risk.
Yeah, so this is like a conflicting results and data.
Yeah.
Huh. Conversely, a recent review found that NSAIDs, especially aspirin, may reduce the risk of several cancers, though regular use of other NSAIDs could raise the risk of kidney cancer. These conflicting results show how complex the interaction between inflammation, immunity, and cancer really is.
Despite the promise, experts warn against self-medicating with ibuprofen for cancer prevention, like I was asking about earlier. Long-term or high-dose NSAID use can cause serious side effects such as stomach ulcers, gut bleeding, and kidney damage.
Gee whiz.
Yeah, what's
Contraindications.
side effects, man?
Yeah.
No
Less
diarrhea, though. No
Yeah,
diarrhea.
no diarrhea. Less commonly, they may trigger heart problems like heart attacks or strokes, possibly death.
Yeah.
Just stick to snake oil, okay? NSAIDs also interact with several medications, including warfarin and certain antidepressants, increasing the risk of bleeding and other complications.
The idea that a humble painkiller can help prevent cancer is both exciting and provocative. If future studies confirm these findings, ibuprofen might one day form part of a broader strategy for reducing cancer risk, especially in high-risk groups.
Yeah, or cause a heart attack and stroke. Who knows?
Yeah.
For now, experts agree it's wiser to focus on lifestyle-based prevention, eating anti-inflammatory foods, maintaining a healthy weight, and staying physically active.
Everyday medicines may yet hold surprising promise, but until the science is settled, the safest prescription for cancer prevention remains the oldest one. Eat well, move often, and listen to your doctor before reaching for the pill bottle. Ah,
I like that
okay.
advice.
You do?
Yeah. Eat well,
Okay.
move often, talk to your doctor.
Okay.
You don't like doctors. You don't trust them?
Well, it's not that I don't trust them. I just don't like going to. I don't like going to the doctor's office or a hospital. So, but I mean, when I have the last few times that I have, I've been pleasantly surprised. But and I get the older I get, I'll probably be doing that more often. So at least that's kind of the census on it. So anyway,
All right, folks. Thanks for joining us. We'll see you in the afternoon.
take care, everyone. Have a good morning. Thanks.